I'm Kelsey LaRose. I'm a nursing student from Lincoln Technical Institute, and I'm here to do my head-to-toe assessment. Hello, I'm Kelsey. I'm going to be your nurse today. Is it alright if I do a head-to-toe assessment?
Yeah.
Okay, I'm just going to provide some privacy. Good. And can you just tell me your name and date of birth, please? Good. And can I just check your bracelet to confirm that? Perfect. Thank you. I'm going to start off by asking you a few more questions, if that's all right. Are you experiencing any pain?
Yes, I am.
And where is the location of that pain?
In my right knee.
Okay, and on a scale 0 to 10, 0 being no pain and 10 being the worst pain ever that you've ever experienced, can you scale that for me?
Just like a 3.
Okay, and is there anything that you do to make it better or worse?
I put ice on it to make it better.
Okay, all right, I'm gonna ask you a few more questions. Do you know where we are today?
Yeah, we're in the hospital.
Good, and do you know what year it is?
2022.
And the president?
Joe Biden.
Good, and the season?
Summer.
Good, and the patient is alert and oriented times 4. Are you experiencing any nausea or vomiting? Shortness of breath? Numbness or tingling? Okay, I'm just gonna go do some hand hygiene and I will be right back. And my hand hygiene will be at the end of this video. And now I will come and put my gloves on. I'm going to be inspecting your scalp, looking for any bumps, lumps, or infestations. Do you mind if I touch your scalp? Thank you. Just looking all around for any bumps or infestations, and the scalp is free of any of that. I will take my gloves off and I will put some hand sanitizer on. Hand hygiene. Okay, and do you have any vision problems? Okay, I'm just going to assess your eyes now. I'm going to start by looking at the pupil size, which is a 3, which is normal. And now I'm going to look at the sclera, which is white, the iris, which is blue. And can you just pull down your eyelids for me? And I'm going to look at the conjunctiva and make sure it's nice and pink and moist, which it is. Thank you. And now I'm going to make sure they react to light with the swooping method. Good. Good. Thank you. And now I'm going to have you follow my pen, just the tip of it without moving your head and just your eyes. Good, and the eyes accommodate. So the pupils are equal, round, and they are reactive to light and they accommodate. Thank you. Now I'm going to go down to the ears, and now I'm going to make sure they are equal on both sides. And I'm going to look behind the ear for any breakdown. Nothing. Go on this side for any breakdown. Nothing. And now I'm going to pull the pin out up and back. I'm looking for any drainage and make sure the tympanic membrane is a nice pearly gray color. And do it on the same side. And do it on the opposite side. Up and back. Make sure the tympanic membrane is nice and gray, pearly gray, which it is. And there is no drainage and no breakdown behind the ears. And now I will go down to the nose. Make sure there is no deviated septum, which there is not. And now I'm going to look for any drainage. There is no drainage and it's nice and pink in there. And now I'm going to have you cover one side of your nose and blow out. And on the other side, please. And the nose is patent. And now I will go down to the mouth. And do you have your own teeth? Okay, no missing or anything? Okay, I'm going to have you open your mouth. The lips are nice and pink and moist. I'm going to use my pen, make sure the buccal is nice and pink and moist. Good, and make sure there's no cracks in the teeth or any lesions or in the mouth or sores or anything like that. And the mouth is free of all of that. And now I'm going to go down to the neck. I'm going to make sure the trachea is midline. If you could swallow for me. Good. And I'm going to palpate the lymph nodes. Make sure there is no swollen lymph nodes. Good. Thank you. And now I'm going to see if there's any JVD present, and I would have the patient in a 45-degree angle, and I will have them look that way for me, please. And using my pen light, I will look for any bulging, which there is no bulging present, and the same on the other side, and there is no bulging present. And while I'm here, I'm going to look for any tenting at the clavicle by squeezing, and there is none. And now I am going to listen to the bowel sounds, but before I do that, I'm going to ask a few more questions. Did you have a bowel movement today? Was it normal?
Yeah.
What was the color?
It was brown.
Okay, and did you have any problems making it to the bathroom in time? No constipation or diarrhea? Okay. And now I'm going to listen to your bowel sounds. I'm going to start in the right lower quadrant. And I will listen for a full minute. And I want to be able to hear 5 to 30 clicks. And if I do not, I will listen in each quadrant for 5 minutes. Starting in the right lower quadrant. Listen for a full minute and make sure you hear 5 to 30 clicks. And the clicks are present. So now we'll go up to the right upper quadrant and listen for the clicks. And they are present. And now I will go up to the left upper quadrant. And the clicks are present. And now the left lower quadrant. And the clicks are present. Okay, have you urinated today? And did you have any problem making it to the bathroom in time? Did you have any burning sensation? No problem starting the stream? And what was the color?
It was a pale yellow.
Okay, so the patient is continent. And now I'm going to listen to your lungs. I'm going to listen to them anterior and posterior. And 5 sounds on the front and the back. Making sure you're not on any bony premises so you can hear them. You're going to make sure you don't hear any wheezes, crackles. You want to make sure they are clear. And now I'm going to have you lean forward for me. The lung sounds are clear. Okay, and the lung sounds are clear. No wheezing or crackles present. And now I am going to listen to your heart sounds, if that's all right. And starting at the aortic valve, at the second intercostal space, I want to make sure that I hear lub-dub. And lub-dub is present. And this is the second intercostal space on the patient's right side. Then I will go over to the second intercostal space on the patient's left side, which is the pulmonic valve, and I'm listening for lub-dub, which was heard. Then I will go down to the third intercostal space, which is Erb's point, and I'm listening for lub-dub. Then I will go down to the tricuspid valve, which is the fifth intercostal space, making sure I hear lub-dub. And then I will go to the aortic valve, listening for lub-dub. I meant the mitral valve, sorry. And lub-dub is present. And now I'm going to listen to the apical pulse for 1 full minute. And the patient's pulse is 82 beats per minute, which is normal. And now I'm going to have you, can you just show me your fingers for me? I'm gonna look for any clubbing in the fingers, which there is none present. And now I'm gonna do the capillary refill, and I wanna make sure it's less than 3 seconds in each finger. And that is good, thank you. And now I'm gonna listen to your radial pulse, which is strong bilaterally and even. Thank you. And now I'm going to look for any edema in the legs, if there is any edema present. And there is no edema present. And while I am down here, I'm going to check for the dorsalis pedis pulse on both sides. And it is strong and even on both. And now I will listen to the posterior tibial pulse. And it is strong and equal on both sides. Thank you. And while I'm here, I'm gonna have you, can you push down on my hands like a gas pedal? Good, thank you. And now I'm gonna have you do your shoulders, move them up and down, good. Now can you do your wrists for me? Good, thank you. And now, do you have any problems with your gait mobility, your walking?
No.
Okay. I'm gonna have you, if you could sit on the side of the bed for me. Okay, and now I'm gonna have you walk 5 steps forward and 5 steps back to the bed if you can. Good, thank you. And patient walks without a walker or anything and is very steady. And during this assessment, I was searching the whole skin for any bumps, lesions, making sure the skin was free of any abnormalities. And this concludes my head to toe assessment. Thank you.